So this patient presents for removal of a lesion that's sort of at the apex of his head. It's mobile. This is almost certainly going to be a pilar cyst. So we've added some anesthesia underneath this. I do warn residents, a lot of us don't have the surgical markers where you're marking out the space where you're going to be at. Just be careful with that because you can lose track of your position quickly. So certainly they have their application. I find as long as you keep track of where you're at, I've never had an issue with it, but you should make note of that if you're going to be doing a spot that's more difficult to sort of keep track of where you're at with things. And smaller cysts, you can lose sight of them. So he's got some freezing in through here. We're going to do an incision in this fat plane, and then we're going to dissect that out and see how we do with things. That doesn't hurt at all? No pain there?
No.
So again, this is a number 15 blade that we use. His hair is at a length. I certainly wouldn't cut this. If you do ever cut it, and you can certainly have that option, you would clip it. You wouldn't want to shave it because that increases surgical site infections. So you could always clip it. Patients in general don't appreciate it. The problem with this length of hair, so longer hairs, you could certainly pin them down. This is sort of in between. It's not going to help us a lot. It won't interfere to any great degree, but it can be a little bit frustrating if you're not used to working with it. So again, here I tell you, if you just progress slowly, you get frustrated watching because it doesn't open up as quickly as you'd like, but that's okay. It doesn't open up at all. So here, as well as the layers of the skin, you're often going to have the complication of the hair follicles that'll just make this a little bit stronger. So it really won't open up until you get a little bit deeper. But you want to be careful with it, only because sometimes the cyst will lie just under the surface. And again, you know, if the capsule ruptures on these, it's not the end of the world. As long as you get the capsule out, you'll be fine. But if we can, we'd like to avoid that rupture. And you should always be aware the scalp can bleed quite a bit. So even whenever I do these type of procedures, we use xylocaine that has epinephrine in it. So the epinephrine causes vasoconstriction, so there's less bleeding. But sometimes that just doesn't matter. The scalp can be so vascular that it'll just bleed on you. So always be aware of the position you're putting your patient in. You know, sometimes if you're stuck in the emerge or situations like that, you can be working in an environment that has less ideal beds and those type of things, and sometimes you'll be pushed to sort of try and do an excision with the patient sitting up or whatever the position may be. You just have to be aware of running planes, which seems like a small thing to consider, but trust me, once you've done it wrong once and you know blood's sort of running down into the patient's face, you won't do it again. So even still, I've put 3 small runs into it and it's not opening up at all. And part of the reason why I'm going slowly with this is this one feels like it's not that deep. And that's not hurting at all?
No.
No pain? So it's starting to open up a little bit, but not as much as I'd like. So you can see, just if you can appreciate that there. Does that hurt at all?
No.
So you should be able to appreciate on the video. This area's not opened up, but up here it's just started. You can just, if I open this up a little bit, you should be able to see a little bit right there. That's the cyst capsule underneath it. You've seen me do this before. I use the Cryleys just to I'm at the plane I want now, so I just extend that just a little bit to open it up that way. And the same thing from this position. So this is just protecting the back end of it. So now you should be able to appreciate that that's the cyst lying right there. And you're feeling pressure type, but nothing more than that, correct?
Yeah.
So while this might seem like I'm not doing anything, this is just slowly encouraging the breakdown of superficial adhesions. Just popped out. So just like that. So it popped out completely. There's a little rupture in the membrane right there. But this is the entire cyst that came out. You okay?
Yeah.
So this isn't actually cyst material. This is just superficial tissue I'm cleaning out so that when I'm doing my stitches, it's just not getting in the way. Everything else should be clean. And I will start to try, I have an apparatus, a magnifying lens that has a light source in it. I'm going to try and see for the next couple if I can actually, I don't know if it'll get away the images at all, but see if so I can let that shine in so you can see that better, but this is completely clear. So this is just 4-0 suture, Proline. So this is pretty straightforward sutures. Lots of resins and doxytin lost them. The only points I would say here is when you're leaving your tail, which you're trying to grab with your needle drivers, just leave it a bit long so it's above the hair follicles. You might waste a little bit of suture material, but it makes it a lot easier than when you're grabbing his hair. Now you'll notice there a little bit of hair gets caught back down in that. We'll just tease this out once this is done. And that comes out easily. And you should be, when you're just looking at this, gauging how many sutures you're going to put in. This certainly looks like 3. Should be more than ample for this. It's just, it doesn't look like it, but the incision goes a little bit lower here, so I'd argue maybe not doing this one, but just so it's sealed well. So if you can appreciate why I'm doing this, this needle driver It's one I'm going to replace. It's slipping a little bit, so it's not grabbing. The teeth are worn a bit, so this is one that I'll have to get rid of. So this is clear. So all I'll do afterwards is I just go along it with the scissors, and the scissors will allow me to tease out the hair just like that. We'll complete that afterwards. And that's it.